Good afternoon, everyone. My name is Denise Mananis. I'm the AVP for External Affairs for St. John's Riverside Hospital, and I welcome you today to another episode of Riverside Talk. We are having a little bit of technical difficulties, and so we are going to start by hearing our speaker today, but and hopefully we will get his visuals to join us shortly after that. But to begin, I would like to, well, first, we're going to be talking about what to know about hearing loss, and we're very excited about that. We have a wonderful speaker for you, but I'd like to begin first by thanking my team who are diligently working behind the scenes right now to try and solve this issue. That is Jason Latour, Nancy Anabi, Candace Cousins-Hopkins, all of whom do a wonderful job at planning and executing and promoting these webinars for our community. I'd also like to welcome all of our audience today. If anyone in the audience would like to join the conversation, you are welcome to go into our Q&A on the application and write in your questions. And if we do not address them during the course of that, feel free to get the questions in, and I will address them at the end of the presentation. Also, I'd like to acknowledge some of the people in the community and some of the organizations in the community that help spread the word about our webinars and make these possible for the community. Our original partners are Yonkers Neighborhood Naturally Occurring Retirement Community, that's getting easier to say, and Yonkers Public Library were the two original partners who helped us kick off the webinar series a little bit over a year ago. And our new partners, the Ashling Irish Community and Cultural Center, the Department of Veterans Services, City of Yonkers, Ardsley Parks and Recreation, Ardsley Senior Center, Bronxville Community Center, the City of Yonkers Community Baptist Church, the Hastings Community Center, the Irvington Community Center, Westchester Jewish Community Services, and Yonkers Pathways to Success. So we're going to begin today. I'd like to start with introducing our speaker. Dr. Michael Tom is a California native. He attended the University of Southern California, where he was elected to Phi Beta Kappa and graduated summa cum laude. He graduated from the Yale University School of Medicine in New Haven, Connecticut, and received the Upjohn Achievement Award. That's pretty good credentials there, Dr. Tom. He completed 2 years of surgery residency at Yale New Haven Hospital and completed his residency in otolaryngology, head and neck surgery at the University of Southern California in Los Angeles, including pediatric training at Children's Hospital of Los Angeles and otology training with the House Ear Clinic. He is board certified by the American Board of Otolaryngology, head and neck surgery, and is a fellow of the American Academy of Otolaryngology, head and neck surgery, and the American College of Surgeons. Dr. Tom has been practicing with the ENT and Allergy Associates since 1993. He is chief of otolaryngology at St. John's Riverside Hospital and serves on the medical staff of neighboring hospitals. He specializes in general adult and pediatric otolaryngology, nasal and sinus surgery with expertise in endoscopic sinus surgery, using the latest technologies including image guidance and balloon dilation of sinuses. So I'd like to welcome you, Dr. Tom. That's quite a bio you have there, and I actually am very pleased to welcome you. I've known you as long as I've worked here, and your reputation is wonderful, and so we're thrilled to be talking about hearing loss with you. Welcome.
Great, thanks very much, Denise. I'm happy to be here.
So I'm going to start with some basics about hearing loss. What are the main causes for hearing loss?
There are numerous causes of hearing loss. I would say in terms of the main causes, a lot will depend on the age of the patient and the circumstances. In children, for instance, one of the most common causes of, thankfully, a temporary hearing loss is a middle ear infection, where there's fluid in the middle ear behind the eardrum, and the sound can get through very well. Some children, as you know, may unfortunately be born with a congenital hearing loss, and there's a whole list of different potential causes. In middle age, many people, if they have excess noise exposure, can suffer hearing loss. And then as we get older, all of us will usually experience some degree of hearing loss just as a function of time.
So that was an interesting phrase, excess noise exposure, because being a member of the middle-aged group of people on the planet, I have to ask, what does that really mean? Because I know I'm experiencing some issues, and I don't know whether I've allowed myself to have damage to my hearing or not. So what does that mean?
Well, if we're speaking about noise exposure specifically, common causes would be things like exposure to loud music, but many people have occupations or other experiences where they're exposed to a lot of loud noise. So for instance, people who work in construction around heavy machinery, jackhammers, people who do military service where they're exposed to firearms or in active battle artillery. Some people will be exposed to explosive sounds because of an accident on the workplace. And some musicians will have a lot of hearing loss related to, particularly if they play in a band where there's a lot of amplification, just all that loud noise energy getting into the ear over time.
Okay. So when people start to experiencing hearing loss, what are the symptoms that show up that people should be aware of?
Well, most of the time, people would experience not understanding people in their lives as clearly. Now, some people may not recognize that, and other people will tell them, you're not hearing me very well. Sometimes people will notice that the phone sounds different in one ear than the other, or they're having trouble with the TV. The TV has to be louder. They're starting to ask other people, what did they say? For children, they can't always tell us what their symptoms are, but many parents will observe, for instance, if they have to call them repeatedly, or they think they're not listening, but they're really not hearing. In an infant, for instance, there's this thing called the startle response, where if there's a loud noise, usually they'll alert, or if someone drops a pot or a pan. People might not do that. Young children also, if they're having trouble with speech and language development, if there's some element of speech delay, it's always very important to check their hearing, because sometimes they may not have been recognized. Now, the state of New York, thankfully, does have a regulation where newborns who are born in the state do have newborn hearing screening. So now with that new regulation, we're trying to catch most of the young patients who are having hearing loss.
That's very interesting. What does that involve, testing this? What's the screening? What does that involve for a newborn?
For newborns, it's a device called otoacoustic emission. So the ear is presented with some sounds, and the inner ear nerve cells actually will have some electrical activity, which we can then measure. So it lets us know that their inner ear and their hearing nerves are working okay.
Okay, so I understand there are 3 types of hearing loss. Can you kind of walk us through those?
So the 3 main divisions or categories of hearing loss, one is called conductive hearing loss. That's a problem where the ear has trouble with the sound conducting through the ear canal, through the eardrum, and through the middle ear bones to get to the inner ear hearing organ, known as the cochlea. So anything that blocks the sound getting through would be classified as a conductive hearing loss. Some common examples would be wax impaction, where the sound can't get through the wax. In young children, as I mentioned earlier, fluid behind the middle ear or behind the eardrum prevents the sound from getting through. People who've had trauma or bad infections where there's a hole in the eardrum. Sometimes infections or trauma can also affect the middle ear bones. Conductive hearing loss is generally treatable either surgically or medically.
Okay.
The second main category is sensorineural hearing loss, or some people just call it nerve hearing loss. And that's typically a problem in the inner ear hearing organ called the cochlea. So the nerves don't work as well. This can be the result of many different things. Age is a common reason, but strokes, nerve damage from loud noise exposure also affects the nerves. Occasionally, there can be problems with the central nervous system, the hearing centers of the brain. The third main category we would just call a mixed hearing loss. So it's a mixture or a combination of both a conductive hearing loss, and some trouble with the hearing nerves or sensory neural loss.
So where does, as you're aging and that sort of progressive loss of hearing or the keenness starts to fade, is that the sensory neuro
Yes,
type? So that's very common as people age.
very common, yes.
Okay. So do you ever have patients come to you and talk about that sensation where they feel like they hear conversations, but if there's other noise in the room, they can't pick up
Yes.
what's being said? So what does that, is that part of the sensory neuro?
Well, it's
Aging
often a
here.
manifestation when there's trouble hearing and noise. However, it depends on the level of background noise. For instance, even someone who has totally normal hearing, if the background sound is loud enough, it may be difficult to pick out that one voice, that one conversation out of the crowd. So there has to be a certain volume difference between the background noise and that one voice that you're trying to understand.
Okay. So so someone should not assume that they have hearing loss because they happen to have a lot of other things going on around them. They really should go and have it checked.
I agree.
Okay. So let's talk about hearing. I mean, there are ways to deal with hearing loss, and we're going to get to that, but can hearing loss be reversed through medication or surgery?
Well, if it's a conductive hearing loss, usually there are medical or surgical treatments that can address the underlying cause. There are certain forms of nerve hearing loss that may respond to medication.
And now, is that kind of hearing loss something you're born? Can you distinguish between being born with hearing issues and someone who develops that through the ear infection or the wax impaction or trauma?
You can usually distinguish that, yes.
Okay, so for those people who are born deaf, are there treatments for them?
Yes, there are actually, depending on the type, you may have heard of cochlear implants, and that is something that can, in fact, be very helpful for young children in particular.
Okay. So, as a guide for the audience, can you walk us through when we should, like, if all things are normal, life is good, you're going along, when should I come see you? When is a good, moment to say, I think I should have my ears, my throat, my sinuses all checked out to make sure everything's okay and to see, how good my hearing is as a baseline? And then, so what's the prompt to come to see you?
Well, I think anytime there's a question about hearing, it's always important to be able to get a formal evaluation of the hearing. First of all, it's the examination of the ear. Unless there's some wax or some fluid behind the eardrum, that can be addressed. If the conductive mechanism, being the ear canal, the eardrum, and the middle ear are fine, then we look to the inner ear. And depending on the degree of loss, many times there can be treatment, particularly with hearing aids. Right.
So before we get to that discussion, because that's an interesting one, I think there's a lot of work going on with hearing aids. But what happens at the visit in your office? What constitutes the exam?
Well, like any other visit for a medical evaluation, we usually start off with a patient history. So how long has this occurred, if there are any additional symptoms, for instance, pain or drainage, if there was any trauma, if there was any noise exposure that might have been contributing. Sometimes a family history can be helpful as well.
Okay.
After we go through the history, some additional accompanying symptoms may be ringing in the ear or buzzing, also known as tinnitus. Some hearing trouble is also associated with things like dizziness or vertigo, because the hearing portion and the balance portion of the inner ears are connected.
Oh.
So once we go through the history, then there's the physical exam. Typically, we use an otoscope. And, much as most doctors will do, we'll just take a look at the eardrum and the ear canal. After that, there's the formal hearing test that's usually done in a soundproof booth. And we present sounds and we see how loud it has to be before one can detect the sound. In addition, though, because what really counts in life is how you hear the people in your life, we present words. So we see how loud a word has to be in order for the person to detect it. And then after that, we give a word list to see how clear and sharp their hearing is.
And so it's not really an invasive other than checking all of that. It's really a measurement of what they can hear and how.
Yes. Now, sometimes there are additional tests depending on the kinds of diagnoses we're trying to rule out. So on occasion, for instance, there can be a CAT scan to look at the structures of the middle ear, the ear bones. If there's been trauma, or if we see something behind the eardrum, then imaging studies like a CAT scan would be very important. Finally, there is sometimes a problem with either the hearing nerve or the hearing centers of the brain. In those cases, an MRI scan can be very, very helpful.
You know, you mentioned something before too about genetics playing a role when you're talking about giving the history. Can loss of hearing in your lifetime be something that's genetic?
It may, but it depends on the presentation. Most things that are hereditary tend to present a little bit earlier on in life, so in adolescence or by early adulthood. Typically, if someone has normal hearing until they're middle aged, there's usually a different non-genetic cause.
Okay.
There are always exceptions, but that would be the general consensus.
Okay. And so going back to the exams, how often should you go and get your hearing tested?
Well, it depends. If someone doesn't have any trouble, there's no prescribed formula. Typically, though, as I mentioned, it's usually screened in newborn, often in elementary school, there's screening. Some jobs do require some screening. For instance, my patients who are police officers, or when GM was here in Tarrytown, people who work in noisy places. But definitely, I would say if someone has any ear symptoms, even if just pain or drainage, a check of the hearing is a good thing to do. If the hearing is normal, we don't usually have to check it on a regular basis, but can certainly change it if there's a change in their symptoms. If we do identify some hearing loss, though, very often we would check it once a year if it's a nerve hearing loss, or if there's an active problem, then we can check it after treatment. A common setting would be young children who have fluid in their ears, and then once the fluid goes away, either through medical treatment or in some cases, little tubes being put in the ears, then we recheck the hearing to see how much better it is.
Okay. So are there diseases like maybe even childhood diseases that are very common that we should all be vaccinated against, but are there certain things that people can get that will cause hearing loss? So it's not just a sort of over time or aging or normal progression of loss, but something that can really affect the hearing.
Some childhood diseases, including mumps and measles, can cause some pretty significant hearing loss.
Wow. Another reason to be vaccinated.
Yes.
Okay. So nothing else, though, that's floating around? People didn't experiencing anything through COVID, or did you see anything like that?
Well, there have been some reports. As you know, COVID has affected the body in so many ways, and we're still learning a lot about it, even this far in. There have been reports of hearing problems related to COVID. There have also been reports related to hearing trouble related to reaction to the vaccinations.
Okay. All right, that's interesting. So it's another thing people should be thinking about if they're suffering from long COVID issues, that could be a related issue.
It's reasonable. Another common, well, I shouldn't say common, but people who undergo chemotherapy, some chemotherapy medications can also affect the hearing.
Okay.
So that would be another time to consider getting a baseline hearing test and then perhaps monitoring it at some point during the course or the conclusion of their therapy.
Have you, this is sort of out of left field, and you may, I don't know why I'm thinking this, other than we have a service here called hyperbaric oxygen therapy, and it has actually helped someone who went in with, I think they were going in for, they were having radiation for cancer, part of their treatment, and it was helping deal with sort of the radiation discomfort that they had, but it also positively impacted their eyesight. Now, is that something that could also aid in hearing?
Yes. Yeah. In fact, I do have a patient who I just referred for hyperbaric oxygen treatment who sustained
Wow.
what we call acoustic trauma. So not just a lot of noise exposure over time, but a single explosive episode where there was a severe explosion and really severe energy that got into the inner ear and caused damage.
Wow. That's very interesting to me. There seems like a lot of stuff coming up about hyperbaric oxygen therapy that seems like it helps an awful lot of things. So, okay. So there's two sides of this. One, we're going to start with prevention of hearing loss, and then we're going to go to dealing with hearing loss. So let's start with the prevention. You're born normal and you are going through life, and maybe you are exposed in your workplace, as you've mentioned, to lots of noise. How do you prevent hearing loss over time? How do you preserve the acute, the keenness of your hearing?
Well, I would say one thing definitely is try to avoid exposure to loud noise. If one is, though, required to be in a noisy environment, definitely get hearing protection. So typically there's the earplugs. What's actually more effective are the ear muffs that go over the ears. So you can think about the people on at the airport who are guiding the planes in.
They're wearing over
the ear muffs. Yeah.
Yeah, interesting. Okay, I see. So that's recommended for on the job and all of that. But it's interesting, and I don't know if this there's a lot of times I'm in an environment and I don't consider it to be too much noise, but my watch goes off and says loud environment. Is even just that measurement going to impact my hearing? Maybe
Well, I would say for sure,
talking.
the very short duration should not, but it makes you more aware. And I think that's one of the big things about tech. It gives us little hints about what we're being exposed to.
Okay. All right. So let's talk about dealing with hearing loss. And I think the dreaded conversation that everyone comes to, which is, I've had it with both of my parents. I know my step parents, everybody who has been going through things. I don't want a hearing aid, but I know they've come a long way. Can you talk us through the technology of hearing devices and what's really available and how expensive it is and how accessible it is for people?
So hearing aids are probably the very best way we have to treat nerve hearing loss when there's no medical or surgical alternative. One of the things about hearing aids is that they have become a little more available. As you may know, the FDA has approved over-the-counter hearing aids, but that's only good for mild to moderate loss. And it's kind of a one-size-fits-all. The best and ideal amplification setting is to have a set of custom hearing aids guided by an audiologist or hearing aid dispenser.
Okay.
And so basically, it would be programmed specifically for the degree of hearing loss that one has. I guess one could also make the analogy to vision. So if you just have some mild trouble seeing, you can buy the little reading glasses at your local pharmacy. But if you have anything more severe or having trouble, then you go to an optometrist or an ophthalmologist and you get a set of glasses that's specifically for your vision. And that's typically the best result.
Okay, so when you go, you have to go to an audiologist. So I come to see you, you make a diagnosis that there's, some hearing loss that's age related, and I go to the audiologist, and they do what?
Well, after the hearing test is performed and reviewed, and then we believe that a hearing aid would be the best thing. There are a few other tests to measure how loud sounds can be at a comfortable range. Typically, there are many choices with hearing aids, so you can get a good basic model, but many models will have additional features. For instance, many will have a Bluetooth feature, so that you can actually hear your telephone or your TV, and you can stream that sound through your hearing aids. Not everyone needs all the features, though.
Yeah, but that's sort of cool that it's happening. And I also understand that you can use your AirPods, you know, the earbuds, to help magnify sound. Is that a thing that's happening?
It's certainly possible. I have not tried it myself, but it seems like a very easy fix. Now, again, it may amplify all the sounds, all the frequencies the same. So many people, for instance, particularly over time, age-related hearing loss tends to affect the highest frequencies the most. And the lower frequencies usually aren't as bad. So you can think about on a radio, or if you're listening to music, the treble is turned way down. So everything sounds very low and bassy. And many times things are a little muffled. They're softer, rounder sounds, not as sharp or crisp or bright. So that's where the customization comes in, to really amplify the sounds in the frequencies where you really need it. So it restores that natural, original spectrum of frequencies, be it in a piece of music, in the voice, on a TV show, etc.
It's kind of cool, all the stuff. And I understand too that the hearing aids now are becoming so refined that even as your hearing loss progresses, as you get older and older and become elderly, it's still, and your hearing becomes worse, they're still able to give you some hearing. Because I think, I mean, I experienced it when I was a kid. I saw even my great-grandfather who became stone deaf. And that was really problematic to speak to him and have him engage in anything because he couldn't participate. But my understanding is now that the mechanisms and the tools that we have can actually help even if you become that level of deaf. Is that true?
That's true. Yeah, so it can become very isolating when you can't hear and interact with the people in your life. In addition, there have been a lot of studies showing that it can be a cofactor in brain function and dementia. So the more one can hear and understand the people in their lives and interact with others, I think it does reduce the progression of dementia.
That's really interesting. Is there a recommended volume that people should be listening to their devices? I mean, everybody's got the things plugged into their phones, and they've got the earbuds in, and they're listening to the TVs. And I know in my house it's way too loud. My husband is definitely someone who should come visit you. But is there a recommendation of where people should be limiting themselves?
Well, I guess it would be difficult because it depends on the circumstances and what they're listening to in their underlying hearing state. But I would say that just the minimum volume where you can understand things.
Okay.
You don't want it too loud.
So it's different for everybody.
Yeah. But if other people start complaining it's too loud, it's probably worthwhile to get your hearing tested.
Yes. Okay. So are there any things, any questions that we did not cover about hearing? Because, Dr. Tom, I'm so sorry that we can't see you, but I'd like to invite you back in the future for, I know you handle different areas other than ears. I'd like to come up with another topic and iron out our technical difficulties here and let our audience see who you are. Is there anything that we missed in this discussion on hearing loss?
Well, it's a really broad topic. I would say, for practical purposes, another very important thing is just kind of listening environment. And also, even though one may have excellent hearing to begin with, if the person who they're trying to listen to isn't speaking loudly or clearly or directly enough, you may not be able to hear everything they say. Some people tend to mumble. Some people are soft-spoken by nature. Another big thing which we've been through with the pandemic is that when people are wearing face masks, you can't see them talk. And it's not that everyone lip reads, but I think our brains are used to bringing in all of the data that it can gather during a conversation. So besides what you hear, you're looking at the person speak. And even though you may be seeing their mouth move, you're not really doing a firm analysis of their mouth movements, but your brain is used to that, seeing their facial expression, seeing their body language, seeing their gestures. All of that contributes to the understanding of the message.
That's very interesting. Go ahead.
And then the other factor, which you alluded to already, is background noise. So now that it's safer for everyone to get together and to go out and to see other people in large group settings, the background noise can definitely be a problem. So if there's an important conversation, it's important to find a quieter place with as few distractions as possible. Even if it's not that loud, for instance, if someone is using a cell phone or there's music on in the background and the TV is playing, all those things will get in the way of maximizing the understanding of a conversation.
Is this related to the idea that multitasking is sort of a myth? When we're being assaulted by all of this input, music in the background, someone speaking over there, there's a whole thing going on in the restaurant you're sitting in, and your brain is trying to pay attention to too much information. Is that impacting what you hear because you're not really dialed in?
I think that's an excellent point. I think people have sometimes used the word sensory overload, and the multitasking, I agree. What I've read about brain function, it really is a myth. So we're kind of focusing on one thing, but quickly switching to another, or switching back and forth a lot. So usually the brain is just handling one thing at a time. But when it's faced with numerous things and it's switching back and forth, there's a little less time and concentration on, for instance, listening to the person across the table from you.
Okay, so that's very interesting. So because I feel it too in my daily world that I'm so much stuff is coming at me that I feel as though I really didn't get a whole lot from everything, and I'm just touching the surface of things. And I was thinking, okay, I can't hear, but maybe it's not that. Maybe it's just too much information.
But I think, yeah, it really depends on the quality of the message, the quality of the speaker's voice, and any sound between their mouth and your ear.
I find this conversation very interesting. Again, anything else that we didn't cover that you think is important?
Well, I would say, in addition to hearing aids, there are also other devices that can help people with hearing loss. There's a whole category of products called assisted listening devices. So you may have seen some of them. There's even short of a hearing aid, there was something called a pocket talker. I think there was Macaulay Culkin had one on Home Alone. They also have things that you may have seen advertised on TV or in CVS called TV ears. So it's a set of headphones that one can wear. And typically, the person with the hearing loss can adjust the volume as loud as they want. But the TV volume in the room can be independently set. That's a big complaint in a lot of households where one person has trouble hearing and the others may not have as much.
Wow. And where does one buy those?
You can go online. I think some of the places like CVS and Walgreens may also carry them. But if you just go online and search assisted listening devices, there's a whole range of products. Even, for instance, this was years ago when my mother was first diagnosed with hearing loss. In the state of California, they provided them with a special phone. So instead of just ringing, the ringer was louder, but it also had a flashing light. Right. It also, for people with other kinds of disabilities, had really large buttons with really large numbers, so someone could see it, and also, for instance, if they had arthritis, be able to press the buttons accurately. Even now, there's actually a device called Caption Phone, which uses voice recognition technology, and so it will actually print out on a screen what the other person is saying. They've even advertised that on TV. So I believe there are programs that actually will provide the device free of charge. A person just has to have an internet connection because it's an internet-based program.
Got it. Well, that's really very interesting. I mean, I didn't realize there were so many tools available, although I don't know why I'm surprised, because you can program your phone to also do that flashing light when it rings. Yes. And I guess we have a lot more technology, but it's very hard when you're in your middle age to sort of understand what's really available. Is there a place that people can go and research for themselves, a reputable place with good, solid information on hearing loss?
Well, I think there are many good places. One place I always like to refer to, our specialty, ear, nose, and throat, is also known as otolaryngology. So we have an academy, the American Academy of Otolaryngology, Head and Neck Surgery. So it's the professional organization for physicians who are in our specialty.
Okay.
And they do have excellent patient resources. And I think, like anything else on the internet, the quality of the information depends on the source. So I can provide those things for you that can be posted.
That's wonderful. In fact, I think that, I think this is such an interesting topic, and one that people sort of deal with on their own and don't have a lot of, even webinars like this one to sort of go and listen to and watch. And by the way, this program will be posted to all of our social media sites, if not by tonight, then tomorrow morning. So people who were not able to listen in live can get the benefit of the information. And we will be posting it on our website and sending it out in various other ways. So, I think there's more discussion about these sorts of specialties and these sorts of issues that people have as they're aging. Because, to be fair, we talk a lot about primary care. We talk a lot about very disease-specific things, but this is sort of something that impacts almost everybody at some point. And there's always that, well, I don't know what to do and I don't know where to go. And I think that's important that they have somewhere they can access. And I'm happy to post that information you send to us. We can post that for our community as well. So, Doctor, I really appreciate your time, and I hope that you enjoyed our discussion today. I would like to actually do a post up for Dr. Tom for our audience. And there it is, Dr. Michael Tom, ENT and Allergy Associates. He's in 1086 North Broadway. His phone number is there, 914-963-8588. Certainly, you can find him on our doctor directory at riversidehealth.org. And just click on Doctor Directory. And if anyone out there is still feeling a little concerned about going into for an appointment and they have questions or they want to be seen for something, we are still offering virtual urgent care. It is through our St. John's Medical Group, and that number is 914-207-0006. And finally, for general information, if anyone in the audience would like information answered that was not answered today, please email me at info@riversidehealth.org, and I will get those questions answered by Dr. Tom. And again, physician referral, find a doc at riversidehealth.org or 914-964-4DOC to get Dr. Tom's. That's another way other than riversidehealth.org to get Dr. Tom's information. Thanks again, Doctor. It was a great pleasure having you on Riverside Talk today.
Well, thank you very much, Denise. I enjoyed our conversation and happy to address other issues and questions in the future.
Wonderful. We're looking forward to it. Thanks.
Thank you.